Support for the Idaho Matters podcast is brought to you in part by University of Idaho, Idaho's only Carnegie R1 classified research university. Our Carnegie R1 designation recognizes the discoveries we make that help our forests thrive. It means we're creating more doctors and doing real research to strengthen cybersecurity for Idaho businesses, our energy sector, and every Idahoan. More at go.uidaho.edu/Idaho-is-Idaho.
I'm Gemma Gaudette, the host of Idaho Matters. We'll be taking you to all Idaho's 44 counties this year, like when we heard about the 125th anniversary of the Women's Century Club in Canyon County.
It's just been such a tradition of community support and wonderful things, and 125 is spectacular.
Who should we talk to in your county? Send us your ideas to Idaho Matters at boisestate.edu and tune in each weekday at noon and 8 for Idaho Matters. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. A new economic impact study is putting a dollar figure on a crisis many Idahoans have been feeling for years: a growing shortage of doctors, particularly OBGYN providers. Now, this report finds that Idaho is losing more than $125 million every year in economic activity as doctors leave the state following the implementation of our state's near total abortion ban. Now, this loss comes as our state's population continues to grow rapidly and as dozens of family planning clinics close across the state. Now, the findings are fueling a new statewide ad campaign warning that restrictive healthcare laws are not only impacting patient care, but the state's economy and rural communities. Joining us today to break all of this down is Amber Nelson. She is the executive director of the Idaho Coalition for Safe Healthcare. Amber, welcome to the program.
Thanks so much, Gemma. I'm happy to be here.
So, Amber, can we start big picture? What does this new study tell us about the economic role physicians play in Idaho?
The big thing that it tells us is that physicians are an economic engine. It tells us that, including all of the ripple effects, physician services, essential supporting services that contribute to how we provide healthcare in the state, it adds up to more than 35,000 jobs and about $5.64 billion in economic output. So what that really means in terms of taxes is about $196 million a year in state and local tax revenue is provided by physicians and the other healthcare providers that they impact throughout the state. So per physician, per doctor, inclusive of both part-time and full-time physicians, it's about $1.34 million in output every year and about $46,000 in state and local taxes.
So that big headline number is $125 million a year lost to the economy here in the state. So how did researchers arrive at that particular figure?
Yeah, so that number actually is specific to the loss of OBGYNs. So if you'll recall, there was research that was peer-reviewed research that was published in the Journal of American Medicine back in July that showed us that 94 OBGYNs had stopped practicing in the state. So when we take that $1.34 million in economic output, multiply it by our 94 lost OBGYNs, that's where we get to the $125 million of loss to the state. And that is only for OBGYNs. That's what we have a hard count for. So this does not account for pediatricians or family docs or other physicians who have either left the state or have chosen not to practice here after residency or refuse job offers here in the state.
So let's talk a little bit more about obstetric providers. Why are OBs such a critical piece of Idaho's healthcare as well as the economic infrastructure?
Yeah, so Idaho has for the last several years delivered babies at the rate of about 22,000 babies per year. So if you think about that number and understand that we need healthcare providers to help deliver those babies just as a human element, we of course need folks here who are trained and able to do that. But when it comes down to OBs, what we know about Idaho is that the loss of OBs has a ripple effect. So for example, when Sandpoint ended up closing down their labor and delivery unit, partly due, there were many impacts or many reasons for that, but a large part of it were Idaho's abortion bans and the decision made by some physicians up there that they could not practice in this kind of environment and care for their patients as they chose to. So what happened is that Sandpoint labor and delivery unit closes down. And now not only are pediatricians impacted because they don't have the new babies there to care for, but women who have gynecological needs. So this could be women of any age. They could be in their teen years just going through puberty, or they could be in their 70s or 80s needing cancer care or other kinds of gynecological support. So women across this state, and we've got about 1 million women in this state, all need this kind of care.
Hmm. And can we talk a little bit more about that part? Because I think sometimes there is a disconnect when we say an OBGYN and everyone assumes, babies, right? You're having a baby. That's all these doctors do. They do so much more than that. And even once, as you mentioned, like once you're finished having babies, right? Or even before you have babies, you start seeing an OBGYN. A lot of women do in their teens just for gynecological care. And then even when you're done having babies, I mean, in order to stay healthy, I mean, you get a pap smear so that you can make sure that, if you have cancer, it's caught early. So what are those real term impacts for, as you said, the 1 million women in Idaho, many of them who are not having children anymore?
Yep. So part of what happens here, and you're right, people focus on the OB piece of the OBGYNs and often think, hey, if I'm not pregnant, if I'm not having a baby, if I am not a woman of childbearing age, this does not concern me. But the fact of the matter is that it concerns not just women, but all Idahoans. And I'll get to that piece in a minute. But in terms of gynecological care, when we don't have OBGYNs, when we are asking women to travel an hour or more for basic, fundamental, preventative health care, and then for treatment, should something be found, should you end up with cervical cancer or fibroids or have a need for hysterectomy, all of those procedures now are further complicated because of the drive times that you will have to endure. So, what we know right now about Idaho in terms of access to OBGYNs, about 85% of our OBGYNs are concentrated in our 7 most populated counties. So in the remaining 37 counties, we have about 23 doctors that are trying to serve about 569,000 Idahoans. And if you just do the math on that, it doesn't work. It's not good health care. And we need to make sure that we're providing care for Idaho's families in order to have a strong Idaho. And when we look at the trickle down effects, when you don't have a practice environment that is welcoming for physicians and they choose not to come here or they choose to leave, in the cases of many of the folks who have left, they are taking other physicians with them. So it's no surprise that we often marry folks from the places where we work. So many of these cases, when OBs, these 94 OBs left the state of Idaho or stopped practicing, they took with them ER docs, they took ophthalmologists, they took other practice specialty spouses with them. So this isn't just about can I get care as a pregnant woman in the state of Idaho? This is about all of the healthcare in the state is connected. And when we pull out or decimate the numbers of OBGYNs that are practicing, it impacts every other piece of our healthcare system, from certainly the economic drivers that this report looked at to the care that people are able to access in their own communities or how far they have to drive and how they are it's more than an inconvenience, how they are impacted and the kinds of hurdles that they have to jump through in order to get to good, safe healthcare.
I'm curious, did your report look at how Idaho's physician shortage compares to other states right now?
So that particular report did not. It was focused on the economic impact. So we were really trying to get at how are physicians economic drivers in this state. But what we do know is that the most the best population or the best physician to population ratios are in Washington, D.C. and Connecticut. They have more than 200 OBGYNs per 100,000 women. And clearly, we are nowhere near those
Mhm.
numbers. So we know that there are maternal deserts in a lot of rural states. And we also know that in our state, it has been deeply exacerbated by our laws that we have that have been in effect now since the Dobbs decision.
So I want to talk about rural Idaho in a moment, but before that, let's talk about Idaho's population because it is growing faster than most of the country. And I'm curious about why that growth could be colliding with a shrinking healthcare workforce.
Yeah, so what we know is that Idaho's population grew about 22% between 2014 and 2024. That makes our state the fastest in the nation in terms of increasing our population. So clearly, when you have more people, that increases the demand, and in our case, really strains our supply. So Idaho has never been at the top of the charts in terms of physician to population ratio. And as the population has increased, our physician population has not increased. And as we know, when we look just at that OB/GYN piece, it has in fact significantly decreased to the rate of 35% since the Dobbs decision. So we have not kept up with demand. We have not kept up with the folks who are moving into the state. And there are a couple of things that we can do to start addressing that. Some of which there's some conversation and I think some inclinations to move in that direction, including increasing graduate medical education so that folks who train here can stay here. But we also need to take a look at how we um, make a more friendly practice environment for physicians to stay here.
So, Amber, I want to pick up on the issue of access in rural Idaho. What are you hearing from rural communities specifically when it comes to access to care?
We know that Idaho is an incredibly rural place. About 93% of our state is considered rural. And across those areas, we have maternal healthcare deserts, we have healthcare deserts. And it is extraordinarily challenging in many cases for folks to get their care they need locally in their own communities. When we look specifically at OBGYNs, we're working on some data that shows the drive times for women who are in some of these rural communities in terms of how long it takes for them to get to a visit. And it is the drive times are increasing over time as we continue to lose OBGYNs in the state. So we've got not only the hurdles of how long will it take me to get to a physician, we have the hurdle of there aren't enough physicians, so I can't get an appointment in a reasonable time. And then when we look at something like pregnancy care, these increased drive times are really complicating for women who have jobs, for women who have other children. And if you just put it into context and think about if you're someone who's perhaps having your second or third child and you work and you need to spend an hour, hour and a half each way to a 15 or 20-minute prenatal visit, it's really unwieldy and it's not safe healthcare. It's not how we
Mhm.
want to be caring for Idahoans.
Did the report touch on at all about what kinds of medical situations providers are most concerned about under our current law?
So this report again looked specifically at the economic impact, but I can tell you from some of the other data that we have collected and certainly the conversations and what we hear from our physicians that what they really need is a friendly practice environment, which essentially means laws and legislation that support the practice of medical standards of care. So those are the standards of care that are accepted by the medical community across the country. They are looking for support in terms of providing or protecting the provider patient privacy, which is often brought up in legislative terms as something that perhaps needs more oversight. The physicians really need to be able to have private, confidential conversations with their patients so that they can get everything they need with and for those patients. And they really need to have the legislative support in order to be able to deliver this quality care rather than more limitations or penalties, fines, threats of jail time. None of that provides a good practice environment.
Mm-hmm. So I want to talk about the Idaho Coalition for Safe Healthcare Foundation launching a statewide ad campaign. Tell us what the goal is of this campaign.
Yeah, so this campaign went statewide, and our goal essentially is to help folks start to think about what safe healthcare is and to really underscore how important it is that healthcare decisions are made between patients and their doctors. The best intentions of our legislature can't supplant or can't replace those conversations that need to happen in exam rooms between patients and their doctors.
And you're focusing a lot of these billboards and ads in rural communities in particular. Why make that decision?
Well, what we know for sure is that in our more urban communities, there is greater access to medical care simply because it's a larger population center, so there are more doctors. There are still extensive wait times. There is still an incredible burden on the physicians in terms of things like taking call and really covering a lot more and working a lot more than is sustainable over long periods of time. But in our rural communities, they don't have access to physicians in the same way. And our rural communities tend to be a little more disconnected from some of the conversations that we may be having in places like Ada County around what healthcare is, what you have access to, and really what the laws are. We've found over time, as we've traveled through the state and done some of our listening tours, that folks across the state don't necessarily understand what the laws are or how they apply to them personally. So for us, it was really a way to reach out to these rural communities and help them start thinking about how do laws impact their day-to-day provision of healthcare, and really what are their rights? What should they be looking for? What does safe healthcare look like, and how can they procure it?
I have a little bit more than a minute left with you, and I want to wrap up by asking if you've had any reaction yet from lawmakers or state leaders about this campaign.
We haven't had a reaction about the campaign, but I will say for the economic impact study, we've had a handful of really great conversations with lawmakers and policymakers who are glad to see numbers attached to our the economic drivers from our physicians in the state. And I would just say for anybody who is curious to learn more about this study, they can find the study on our website at www.idahocsh.org.
Well, Amber, I want to thank you so much for taking time to talk with us today about this. Such important information to really dig down, especially into the economic impacts of all of this. So thank you so much for taking time for us today.
Great. Thank you so much. It's been a pleasure.
We've been speaking with Amber Nelson. She is the executive director of the Idaho Coalition for Safe Healthcare. We've been talking about a new study that looks at the economic impact of physicians leaving the state of Idaho. This did focus mostly on OBGYNs, and what the study has shown is Idaho is losing $125 million a year in economic activity due to that. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.
Looking for another podcast to listen to? Check out The Nature of Idaho from our partner station KISU in Eastern Idaho. Join hosts Peter Pruitt and Dr. Leif Tapanilla as they share fascinating stories from the Gem State's great outdoors, celebrating Idaho's wildlife, landscape, and natural wonders. That's The Nature of Idaho from KISU. Listen wherever you get your podcasts.